A follow now to a story we first brought you yesterday from a woman who says she was shocked that her Medicare Advantage plan was being terminated by her insurer. Now she needs to enroll in a new plan, and she's not alone. It's an issue impacting millions of Medicare recipients, and as Leah Mallory explains, this isn't the first time it's happened. Leah, can you tell us what's new on this story?
Teresa, since our story aired, we've received an influx of messages from viewers who are experiencing this. Several health insurers say they've had to cut select Medicare plans because of rising healthcare costs. This then impacts the consumer, leaving them with limited assistance or none at all. Yesterday, News 8 shared a story from a viewer who didn't want to be identified. She says she received this letter from Excellus stating that the Medicare Advantage plan that she was enrolled in will no longer be available come next year. The provider stated in the letter that her plan, Medicare Blue Choice Select, which includes drug coverage, will not be offered, ending December 31st, stating increased healthcare costs as the reason.
It's scary. I mean, yeah, you're angry, you're frustrated, you're upset, confused. All of a sudden all this stuff lands on your plate.
We spoke with another woman who received a termination letter this week from the same insurer.
And I called to find out whether it was relative to my recent health care issues that cost more money than usual. And they said, no, it has nothing to do with that. They're cutting that particular program completely, which is a lot of people. And they said Excellus is just trying to stay on their feet.
Health plan specialists that we sat down with are telling beneficiaries not to panic.
There's a limited amount of plans that are going to be offered for 2026. Don't fear. This is just a one-year window that we're looking at here. So when you're selecting your new plan to replace the plan that's being terminated, just think about your needs for 2026.
Meaning, he says, that if you have an idea of your upcoming medical needs, keep those in mind when selecting a plan for 2026. They advise people whose coverage is ending to enroll into new plans before December 31st, and if needed, to seek further assistance from health plan agents. In a statement to News 8, Excellus says they will continue to offer $0 premium plans in their regions and remain deeply committed to helping members find the coverage that best fits their needs. And Teresa, we're still getting calls about the situation. Coming up at 6, I'll tell you what a licensed Medicare agent I spoke with says about the whole ordeal and her tips, but I'm sending it back to you.
All right, thank you, Leah. One question though, what happens if someone hasn't enrolled in a new Medicare Advantage plan by that deadline?
The coverage will revert back to the original Medicare plan, which doesn't include drug coverage, but health plan specialists and insurers recommend taking action as soon as possible if you received a notice about your specific plan ending, especially if you have those prescriptions and need the drug benefit.
Get the Rochester First streaming app today for everything you love from News 8 On Demand, plus exclusive shows you won't see anywhere else. Search ROC and download for free on Roku, Amazon Fire, and Apple TV.